Made on Zencaster.
Because Zencaster is the all-in-one podcasting platform that makes every stage of the podcast production process so easy. If you would like to try podcasting using Zencaster, use the link in the description. Hello and welcome to Fit for My Age, the health and well-being podcast from Abeceda. I am Michael Millward, Managing Director of Abeceda. Very importantly, on Fit for My Age, we do not tell you what to think, but we do hope to make you think. Today, I am finding out about natural pain management from Dr. Alex Hilario, a chiropractor at Chiropractic Rehabilitation Source in Yonkers, New York. Dr. Alex has over 20 years' experience in providing general chiropractic services and is an expert in natural pain management. I have never visited Yonkers, but if I ever do get to go, I will make my travel arrangements with the Ultimate Travel Club, because as a member of the Ultimate Travel Club, I get to travel at trade prices on flights, hotels, trains, holidays, and so many other travel-related purchases. You can also travel at trade prices because I have put a link with a membership discount code built in the description. Now that I have paid some bills, it is time to make an episode of Fit for My Age that will be well worth listening to, liking, downloading, and subscribing to. One that will also be worth telling your friends, family, and work colleagues about. Hello, Alex.
Hi, it's a pleasure to be here with you.
I'm really pleased that you are here. Please, could we start by you telling us a little bit about your experience and the sorts of things that you do, please?
Yeah, so I'm a chiropractor. I've been practicing for over 21 years, currently serving the Yonkers, New York area. As an undergrad student, I was a pre-med student. I was looking at different types of healthcare practices to get into, and I was really interested in becoming a pediatrician. But I shadowed different types of doctors, psychologists, podiatrists, dentists, and a chiropractor. And I was actually pretty impressed by what he was doing and how there was like no side effects to the treatment, and it was very effective. And I decided to jump into that, and it has served me well. And I've been able to help hundreds of thousands of people over the years. It's pretty effective and life changing.
Yes. I've visited chiropractors and physiotherapists here in the UK, arrived sort of slightly bent over, probably more than I'm prepared to admit, and left walking tall. It is, like you say, life-changing, but it's the lack of side effects as well in terms of the treatment, but it's a very hands-on type treatment in many ways, isn't it?
That's right. Yeah, a lot of it is manual work.
We all have the same body, but we all operate slightly differently, and getting people into a better way of operating involves getting to understand their body, probably more than they understand their own body.
That's right.
When we talk about natural pain management, what are we talking about there?
A lot of what we do is treating pain, but also correcting the cause of it. A lot of times people will be dealing with neck pain or back pain, and you'll go and take some over-the-counter stuff or reach out to your medical doctor and get a prescription for some painkiller. But unfortunately, these treatments, they have side effects. If you're taking them for a long period of time, they can cause a lot of gastrointestinal problems. I think there was a study that found that there's over 100,000 hospitalizations each year from over-the-counter and prescription NSAIDs, and over 16,000 deaths every year. So it's not without consequence to treat these with over-the-counter stuff and prescription for a long period of time. It's something that you can integrate, and you should integrate if you're in a lot of pain for a short period of time. But you want to treat the cause of the problem, and that's something that we do with chiropractic care. We figure out why the pain started, and we address that, not just treating the symptoms.
I think sometimes it's very easy to forget that the over-the-counter medicines, the painkillers, are there to reduce the pain so that you can carry on with your day. That's not treating the cause, it's just dealing with the symptoms. And I suppose there's also a risk that if you are masking the pain with painkillers, that you might actually do more damage as well because you can no longer feel the full impact of the problem.
That's correct. Yeah.
You talk about we've got to identify the cause of the pain. Is it possible that what someone experiences and describes as their pain may not be the actual cause of the pain?
That's right.
So they feel pain in one part of their body, but the actual source of the pain is it somewhere else?
Yeah, one example that comes to mind is sciatica, and I'm sure a lot of your listeners have heard of that. But in essence, it's a pinched nerve going down the leg. So you may feel this leg pain, and not a lot of back pain. Sometimes no back pain. Sometimes back pain with it also. In essence, it's a pinched nerve that's taking place, usually in the spine, and causing the pain all the way down the leg, even into the foot. So the cause there is a pinched nerve, and massaging your leg all day long, or taking painkillers is not going to correct that.
So we feel the pain in our legs with sciatica, but actually the source of that is somewhere in the spine.
That's right.
And so massaging our legs is a waste of time.
Really.
People hear words and they're given words by doctors to explain why it is that they are in pain, but we go through life saying, well, we have this illness, this pain, without actually ever really properly understanding that. Do you find that the level of knowledge people have about their nervous system, their joints, how their body works is increasing, or is it still something that people need to work on?
It's definitely increasing, but there's a lot of misinformation. A lot of people will also just kind of blame age to their back pain or their neck pain or their sciatica. I'm just older and this is part of it. My dad had it, or my uncle had it, and they just kind of try to manage it with over the counter
Hmm.
painkillers, or just kind of dealing with it. But a lot of it is nerves being compressed. And there's actually a study where a pathologist looked at over 200 cadavers, and he found that there was organ damage whenever there was a pinched nerve. So if
Hmm.
there's a pinched nerve, it's going to lead to other issues. So it's something you want to address. You don't want to just ignore shooting pain into your leg or your arms, or tingling or numbness. And you definitely want to make sure that we're getting pressure off the spine, because the nervous system controls everything, every organ, every system.
Yes. So if we have a muscular pain, a skeletal pain, so it's either pain in our muscles or pain in our bones and joints, that may itself be a symptom of something else because the nervous system conducts the pain from the source to somewhere where it is easier to display that pain.
Yeah. Yeah, and sometimes you could have a pinched nerve and not experience pain, depending on, the function of that nerve. Where does it go? What does it do? So it could be, nerves that go to your digestive system, for example, and that's being compressed there. And you may be dealing with digestive issues, and you may think it's, a food allergy or something to that effect. And it's actually a pinched nerve that is affecting the way your digestive system is working or not working.
If we sort of like bang our hand against the door, the nervous system tells us that we've banged our hand, we are in pain. Right? That's one of the purposes of the nervous system. Correct me if I'm wrong. But
Yep,
another purpose of the nervous system is to tell the brain how all of the different parts of the body are working, and also to get those parts of the body to do what the brain wants. So we want to walk, and so a message goes from the brain to the legs, the feet, to move, and that goes through the nervous system. I'm
exactly.
being very simplistic here, but what you're saying is that if there is a problem in the nerves, then the brain will get the wrong information about what is happening in the body,
Yeah. So
right?
also, your nervous system, your brain, and your spinal cord are sending information to your different organs. So when there less information getting to these organs, it's going to lead to damage to the organ over time. So some of the things that can be, causing illness is, just posture. There
Yes.
was a study that found that when we lose that normal curvature in the neck, that stretches the spinal cord, and that leads to disease. was also another study that found that when our head goes forward by an inch, it increases the weight of the head on the spine by an additional 10 pounds. So your posture is stretching your spinal cord and affecting the nervous system. And when the nervous system is affected, that's going to affect different organs and different parts of your body and your health.
I'm having one of those wow moments. I didn't know that.
So, yeah, a lot of times people will think of chiropractors and think, just neck pain, back pain, have them twist you around and get that popping and that sensation. But it's much more than that. It's restoring motion, it's getting pressure off of your nervous system, and it's allowing your body to function the way it's supposed to.
And the core, so like main line of this nervous system is the spine.
That's right.
And if we are walking incorrectly or running incorrectly or sitting incorrectly, we are likely to cause damage to our spine. And if we damage our spine, then we damage our nervous system as well.
That's correct.
Although I'm having wow moments because of what you're telling me, I'm suspecting that with these types of injuries, they don't happen in a moment. There's an awful lot of things sort of building up.
That's correct. Yeah.
Right. So we get into a habit of sitting in a way which might feel comfortable, but is actually not comfortable. It's just we're storing up and building up pressure on the spine over a period of time, which is ultimately going to damage the spine, the nervous system, cause the pinched nerves, and that will actually could be the prompt, the catalyst for damage, illness in other parts of the body.
That's correct. A lot of times you'll hear that somebody was just, putting on their shoe or they sneezed and they developed severe back pain. So that's accumulation of micro trauma over the years and eventually gets to the point where it kind of breaks the camel's back per se because it's accumulated micro trauma over the years. A lot of bad posture, a lot of sitting the wrong way, little injuries where you fell or you were in a car accident, something even more major like that. But it adds up, and eventually it could get to the point where it's really affecting your nervous system and your health overall.
I think I need to understand a lot more about my spine and my neck and how, well, I know everything in the body sort of hangs off the spine in some sort of way, but I need to understand more. I think we all need to understand more about our spine, don't we?
Yeah.
Things like how we stand, how we walk, how we sit are all impacting our spine.
Yeah.
So at the moment, I am sitting quite upright and my feet are flat on the floor. I'm just checking. That's much better than crossing my legs, isn't it?
That's right. You want to have your feet flat on the floor. You want your hips to be about 90 degrees. You want support in the small of your back so that you're maintaining some of that curvature in the small of your back. You want to have your chest open. You want to be able to look at the monitor straight ahead. So if you're spending a lot of time, a laptop is not ideal. You want a desktop where you're looking straight ahead at the monitor and the keyboard is low. So you're not shrugging your shoulders and you're not rounding your shoulders. You're not leaning forward.
Yeah, because if you are looking down at the screen of a laptop computer, you are increasing the weight of your head every inch by 10 pounds, which is actually then causing a strain. And that's the angle. And there's probably all sorts of physics that are involved in this. But
Yeah,
if your head is upright between your shoulders, then it weighs less than if it's leaning forward.
that's right.
Just trying it out now, and I can see when I look down, I can feel that my head feels heavier than when I sit upright.
That's correct. And over time, that can lead to disc herniations, arthritis, and pinched nerves. So it can be pretty significant. It adds up over the years. So we have all our kids on devices now, and they're constantly looking down. And I'm constantly trying to correct my daughter, who's 13. But yeah, that's become an issue, and it's going to continue to become an issue just because of how connected we are these days.
And when we're using a mobile phone, we are looking down at it, at that screen. Whereas when we use a desktop computer, we're more likely to be looking at it in a horizontal lines, almost as if where the center of your eye and the center of the screen should be in a flat line.
That's right.
Every time you see somebody walking towards you looking down at their screen, and you're thinking like, do they know that I'm here? It's like you can jump out of their way and know that in the years to come they're going to suffer neck pain, back pain, and all sorts of other issues because they've allowed themselves to adopt that type of approach or that type of way of using the mobile phone.
Yeah,
It's it's
yeah.
it's like, what sort of advice are you giving your daughter to use your mobile phone in a different way? How would you like her to use it?
Well, I tell her to bring the device up to her eyes so that she's looking straight ahead, and then to minimize the time that she spends there.
Yeah.
We shouldn't be scrolling endlessly all day long. You should use your phone and reply to a text and put it away
Yeah.
and live life. Enjoy the
Yes.
people that are in front of you.
It's a phone, not a television.
Yeah.
But there is a very real issue associated with the technology, whether it's people sitting at desks all day long because you no longer need to get up from your desk to go to a filing cabinet to get a piece of paper to be able to work on. You use your mouse to open the file on the computer, and that means that the type of movements that we are involved with at work are reduced as well. So that's going to cause more problems as well, I suppose.
Yeah.
You start feeling as if like everything that you do is going to cause a problem.
Yeah, I mean, there's a lot going on with devices and laptops and screens these days that are, affecting our posture and affecting our spine and our health overall. Falls can affect that. Even stress can affect that. So we want to be mindful of that. We want to try to create balance, where we're exercising daily, we're practicing good posture, we're moving. If you're able to get up every hour and take a short break and just move your body, that's going to help a lot.
The solution is like this natural pain management and natural pain avoidance, then is it's not going to cost anyone a lot of money, and it's just not going to take an awful lot of time, but it's just building that into your daily routine.
That's right.
One of the things I think that is a worry for people is that the amount of money that these type of things can cost. Being healthy, it's a business, and people are making lots of money out of providing services for people. Obviously, there's a lot of knowledge and a lot of investment in building that knowledge and a lot of skills, etc. But it's still, health is a business, and increasingly so in many ways.
Yeah, but we also want to look at the cost of not doing anything. What would happen if we didn't correct the pain? How is that going to affect our lives? How is that going to affect our ability to participate in the hobbies that we like, or show up for our families, or
Hmm.
even practice sports or exercise at all? There's a cost to not doing anything, to not correcting the pain and the cause of the pain.
Yes, and I suppose the thing to do is to not ignore the early signs. Put in place everything that you can to avoid having or avoid the risk of developing some sort of spinal nervous system, muscular, skeletal type injury. And if they do did start to develop any symptoms, get any signs that there might be something, then you've got to act quickly in order to get the remedy as quickly as possible.
That's right. Yeah, the sooner you can address it, the easier it is going to be to fix. If you've had an injury when you were in high school and you're, you know, 40, 50 years old and you're still dealing with the same back pain, then it's going to be a little bit more complicated. It's going to take a little bit more to correct. You definitely can see the benefits of getting it treated, especially with something like chiropractic, but that doesn't have any side effects. And it could be life changing for you in terms of living without any pain, and again being able to do the things that you want to do and even exercise more, which in turn is going to help your health in many ways.
Yes. Yeah, I can see that. There's an awful lot of wise words in terms of, you know, keep yourself healthy as best you can. If there is anything that happens, then you've got to manage it proactively rather than reactively and waiting until you can't do anything about it. You've got to start going down some pretty serious medical routes, I suppose. There's also that attitude, I suppose, that we all sort of, stiff upper lip, grin and bear it, don't complain, just, get on with it, carry on. And that is actually part of the issue. We carry on rather than getting something done about it.
Yeah, yeah. That,
Yeah.
especially men, we tend to keep it moving and not really listen to our bodies, especially when people are depending on us. But
Yes.
because people are depending on you is why you want to have, you know, your best health and the best version of you. That's how you want to show up for your family, for your children, for your spouse. And you
Yep.
can do that by, addressing the cause of these problems and exercising daily and practicing good habits.
Do you have people who come to see you when there isn't anything wrong with them? They haven't got any symptoms. They just almost like a recuperation type assessment or treatment, something that just deals with the stresses of every day before there are any symptoms coming up.
Yeah, yeah, we do. We actually have a lot of patients who do maintenance care, where it's like they get treated like once a month or once every few months, just to make sure that the joints are moving properly in the spine. Because, like, if you want to stretch your shoulder, you can do that easily, or your hips, you can do that easily. But it's hard to kind of get that movement within the spine itself,
Hmm.
without somebody kind of evaluating where the restrictions are and making sure that your joints are moving properly and there isn't anything getting pinched there. We do have a lot of athletes that come to our office. I personally myself did a lot of powerlifting not too long ago, and a lot of powerlifters would come to my practice as well to get treated and get that movement in the spine to minimize injury too. Because if your joints are moving the way they're supposed to move, you're less likely to injure yourself, lifting something heavy.
Is the risk of having these types of injuries something that goes across the generations, or some families have a propensity to get these types of injuries whilst others don't? Is it there is some sort of like a genetic aspect to this?
Not so much. No. You'll have families that, practice a specific diet, and, you'll see that they're all a little bit overweight, or you'll have families that are all a little thin because we kind of do what we were taught to do, and how we sit is one of those things, and how we lift, and the kind of work that we see our parents doing, our grandparents doing, they were all blue collar workers, and
Hmm.
they've hurt their back, and then I hurt my back because I'm now a blue collar worker. It's not because it's genetic, but it's more because we're practicing the same things and we're doing the same things.
Right. So our parents ate these sort of food. They fed it to us as a child. We carry on eating those sorts of things. It can be important to review your whole lifestyle if you want to avoid repeating the pain that your parents and grandparents might have gone through as they got older.
Exactly.
Sounds to make an awful lot of sense, really. It's like we all have problems that we have to deal with. We all have health issues, and we have to decide, I suppose, how we want to manage our health before we have the health issue, and make sure that we've almost worked out what our plan is going to be if we engage in a particular type of work, a particular hobby, knowing what the risks are, putting in place steps to mitigate or remove those risks, but how are we going to deal with them if those risks turn into an actual problem?
Yes. And when the pain comes up, it's usually because there's been dysfunction there for some time. So if you're dealing with the pain, that's not where when the dysfunction started. Usually the dysfunction started way before the pain. So if you're experiencing pain, it's something you want to address as soon as possible.
Yeah, it's already happened. What's the sort of thing that the wise words of advice that you would like everyone to just sort of know that would mean that, or would mean that they are less likely to get to meet you because they don't need treatment?
Yeah, I think everybody should integrate, these benign types of treatments, your acupuncture, your chiropractic, your massage, your physical therapy, just because they can be very beneficial. They can make a huge difference in your health, and they don't have those side effects. And a lot of times people will see videos of chiropractors and hear the pops and think it's painful. It's not. It's not painful. So it's worth integrating. Also, the acupuncture, very similarly, it may look painful, but it's usually not painful.
Yeah,
So it's worth integrating, and it could be life changing for you.
yeah. But when you say integrating, you're meaning integrating it into your health management routine,
That's right. Yeah.
which is the proactive part of
Right.
health,
Right.
right?
And a lot of times we'll go see our medical doctors, and it's very important to follow the medical doctor's instruction, but that doesn't have to be where you kind of stop. You should integrate other things that could also benefit you and not cause side effects.
Yes. It's like we go in the United Kingdom, we go and see our dental practitioner every 6 months for a checkup,
Hmm.
just to sort of see how our teeth are. And what you seem to be saying is that we should treat our musculoskeletal system, our muscles and our bones, in the same sort of way. Have some sort of checkup to make sure that everything is operating as it should, and do that every month, every 6 months. So, what would be the optimum checkup time, and would it change as we get older?
Yeah, ideally we start recommending it once a month, depending on your job. If you have a very sedentary job, you want to get checked up at least once a month. If you have a blue collar type of job, also most people, you should definitely get checked out and make sure that your joints are moving properly, your nervous system is not being irritated, and your body's going to be able to not only prevent further injury but function to the best of its abilities.
Well, sounds like very good advice. And you know, Dr. Alex, it's really very interesting. Like I say, I've had some wow moments. So thank you very much. I really do appreciate your time.
Thank you for having me. It's been a pleasure.
Thank you. I am Michael Millward, the Managing Director of Abacida, and in this episode of Fit for My Age, I have been having a conversation with Dr. Alex Hilario, a chiropractor at Chiropractic Rehabilitation Source in Yonkers, New York. You can find out more about both of us by using the links in the description. At Fit for My Age, our aim is proactive, positive aging, and today's episode has been definitely about proactive, positive aging. Knowing the risks early is an important part of maintaining good health. That is why we recommend the annual health test from York Test. York Test provides an assessment of 39 different health markers, including cholesterol and diabetes risk, various vitamin levels, and organ functions. The annual health test is conducted by an experienced phlebotomist who will complete a full blood draw at your home or workplace. Hospital standard tests are carried out in accredited laboratories. You can access your easy to understand results and guidance to help you make effective lifestyle changes anytime via your secure personal wellness hub account. There is a link and, as you would expect, a discount code in the description. I'm sure that you will have enjoyed listening to this episode of Fit for My Age as much as Alex and I have enjoyed making it. Please give it a like and download it so you can listen anytime, anywhere. To make sure you don't miss out on future episodes, please subscribe. You'll probably want to tell your friends, family, and work colleagues about Fit for My Age as well. Remember, the aim of all the podcasts produced by Abacida is not to tell you what to think, but we do hope to make you think. Until the next episode of Fit for My Age, thank you for listening, and goodbye.